Thank you very much, everyone, for inviting me. This is indeed an honor to come to speak to this distinguished group. You know, really, I've been in this work for so long. I graduated from medical school in 1982. I started doing oncology in 1986. So really, I've been in this field for 33 years. And over this period of time, I've seen so many cancer patients, really. You know, just to mention, I boarded the plane yesterday afternoon, and I sat down, I turned on my iPad, I was going to watch a video, and suddenly someone comes in and says, "Oh, hello, Dr. Ang." And she sat right next to me, and this was this 81-year-old lady, someone that I've looked after for many, many years. And she's an Indian national, but she lives between Singapore and the Philippines, and she was on the way home. Why was she coming back here? Because she was going to celebrate her son's birthday. So indeed, one of the most important things to remember is when you help someone, especially in the medical field, when you touch someone's lives, it's not that individual alone. It is really the entire extended family, friends, and so on. So it's very important that whenever you talk about cancer, it's not just the impact on the individual alone, but the impact on the entire group of friends, relatives, colleagues, and so on and so forth. So I happen to like to write, and one of the books that I wrote right from the very beginning when I started doing this field was really this book that I wrote, "Doctor, I have cancer, can you help me?" And in this book, what I shared was about 10 stories of cancer patients and what happened when they were first diagnosed with cancer, what did they do? What did they do to cope with the disease? And it's very important, one of the most important things to arm yourself with is knowledge. Knowledge. Because sometimes there's so much out there on the internet. Even last night, as I was taking part in this radio interview, they were talking about all the myths. Do I take noni juice? What fruits are good for me in terms of treating cancer? And they asked me what I thought about it. And I was very frank. I told him, look, in actual fact, I have got no problems with a special diet in terms of treating cancer, or some said taking ling zi or whatever you have in terms of herbal supplements, or exercise, or whatever. But the important thing to remember is that nowadays there's so much we can do for the cancer patient. Please don't choose an alternative in place of what has been proven or conventional in terms of how we can treat cancer. So today I want to share with you some knowledge, some patient stories in order to help you to understand a little bit about how much we have advanced in terms of treating cancer. The bad news is that cancer is a very serious problem. I was rather surprised that almost everyone that came on this stage, instead of using the real word cancer, they call it the big C. It's almost as if there's something voodoo, secret about this thing, cancer. Well, it is cancer. Cancer is cancer. You talk about someone having a heart attack, why call it the big C? It is cancer. It is something we have every reason to be afraid of, but at the same time, it is not a death sentence. One of the frightening things about cancer, I'm sorry to say this, especially for the patients that we see from the Philippines, are that many patients present with advanced stage disease. What is advanced stage disease? Early stage disease means the disease was small, diagnosed at an early stage. Advanced stage means stage 3 or stage 4. Why is that so? One of the problems is that cancer in its early stages has got no symptoms. So one of you in this room at this very time may actually have a cancer of the lung, but there are no symptoms. So how do you know it's there? By the time you find out, the cancer may have metastasized to other sites. You know how scary it is? 85% of lung cancer patients, by the time we diagnose it, it's already stage 3 or stage 4. Only in 15% of patients we diagnose it early. All right, because early stage lung cancer has no symptoms. So by the time you have a cough, it may not be early already. Number 2, the symptoms of cancer are very non-specific. When you wipe your bum this morning, there's a little bit of blood, nothing. Maybe it's just hemorrhoids, piles. All right, but maybe you already have colorectal cancer. That cough that you had for the last 3 weeks, maybe it's just pollution in Manila, but maybe you have lung cancer. Because the symptoms of cancer are so non-specific, it's very easy for us to just pass it off and say it's nothing serious, when actually it is something serious. So it's very important that you've got symptoms, not to be doctor yourself, but go and see your GP, go and see a general practitioner, have it evaluated. If any symptom persists for more than 2 weeks or recurs, make sure you see a doctor. Sometimes patients know that something is not right. Look, this lump has been growing and growing. They bluff themselves. It's nothing, when I breastfed, it's probably something that's just stuck there, 20 years ago, and it's just a little big problem. No big deal, And some refuse to have treatment because they're so fearful of the side effects of treatment, or they don't have money, and that's a big problem. There are patients who want to be treated but can't afford to be treated. And that's where government and VWOs need to come in and help. And some think that cancer is not curable. If it's not curable, why do I want to treat it? And they go and seek alternative treatment. And that's something that we think should not be done. So, does it mean that every lump is a cancer? No. A lump is a lump. A lump can either be benign or it can be malignant. All right? A cancer is when the cells show disrespect for the regional tissue. What they do is that it grows and grows and grows, and its ability to spread and destroy structures. That's when it is a cancer. Okay? So this mole on my nose, you see this big mole on my nose? What is it? It's a tumor. It's obviously a tumor, but it's a benign tumor. It's been with me for so long. It hasn't given me any trouble. But if this mole one day decides to start eating away the skin around it, spreading to the lymph nodes, then this benign mole has turned into a cancerous mole. That's why if you have a lump and you've had this lump for the last 10 years and nothing happens, nothing, don't worry, it's just a benign tumor. But if you've never had a lump there and now you develop a lump, do see a doctor and have it evaluated. For us, when we see a patient, it's very simple. Our work is very, very simple. Number one, talk to the patient, examine the patient, run some blood tests, do some x-rays. All right? Because the first thing we need to know is it a cancer or is it not a cancer? If it's not a cancer, we tell them, look, please don't worry, this is not a cancer, and you'll be surprised. I saw a lady yesterday, 40 lumps in the right breast, 20 lumps in the left breast, 60 lumps altogether. It's very common. If I start screening all the women in this room, I'm sure I can find lumps in the breast. It's easy. But the large majority of these lumps are benign. It doesn't mean that every lump needs to be removed. Can you imagine this lady talk to me and say, look, I'm so afraid that you'll turn into cancer. Shall I have them removed? I looked at her. There are 40 on one side, 20 on the other. By the time I remove the 60 lumps for you, you won't have any breast left. It's ridiculous. All right, and a doctor who is ethical, will not recommend unnecessary removal of these lumps. Okay, I always tell these patients, I always joke with them, you're a gold mine. You're a gold mine for us. Because whenever we need money, we just take out one of these and we make some money. So can you imagine if we charge $2,000 for one breast lump, for 60 breast lumps? Maybe I should take them out. I'll think about it. Okay? A second most important thing now is it's important to know what type of cancer it is. Gone are the days of the past, you have cancer. Big deal. What is the cell type? All right, it's so important. And what is the stage of the disease? Is it a localized cancer we're dealing with, or is it an advanced stage cancer? There are many, many advances in cancer management. I can tell you from A to Z, the way we diagnose cancer, the way we operate, the ways we give radiation, the use of chemotherapy. We have got targeted molecular therapies. We have got immunotherapy in the way we support cancer patients. In the old days when I studied medicine, you know what it was like? I'll tell you what it's like. We look under the microscope, we look at the cells. We said, these cells are abnormal. These are cancer cells. And then we pass the exam. You look at it, you say, these are normal cells. That means you're good enough to distinguish between normal cells and abnormal cells. You want to get a distinction, you say, these cancer cells look as if they came from the breast tissue. So these are breast cancer cells. But now, it's not enough. One of the lead players in the cancer team is no longer someone like me. One of the lead players in the cancer team is the pathologist. Because the pathologist can give us the information as to how to fight this cancer. In lymphoma, not enough to say a patient is lymphoma. Is it Hodgkin's lymphoma or non-Hodgkin's lymphoma? Non-Hodgkin's lymphoma, is it T cell or is it B cell? If it's B cell, what type of B cell? You know, what is the CD20, etc., etc., etc. We need to know as much information about the cancer as possible. Lung cancer, old days divided into two groups, small cell, non-small cell. Now it's not important. The most important thing, when we get the tissue, we want to know, what are the mutations? In other words, in this cancer cell, what mutations can you find on the cell? Does it have EGFR? Does it have ALK? Does it have ROS1? What is the PDL1? All these funny names I never studied in medical school because they were non-existent. So in the last 30 years, all these new terms we have to learn. That's why I like it when earlier one of the speakers was talking about how she's a student. I'm a student. Every day, every year, we have to keep in touch. What are the latest mutations? And now you know we've got these great companies that can profile all the mutations in that particular cancer. And of all these mutations, they have to tell me what are actionable mutations and non-actionable mutations. Now, what is the difference between the two? In almost every cancer cell, you see hell of a lot of mutations. But it's no point for you to tell me it's got A, B, C, D, E, F, G. But medical science has not developed treatment against this mutation A, B, C, D, E, F, G. You must tell me, these mutations we have found, but we don't know what to do. These mutations we have found and we know what to do. They are actionable mutations. If you have an actionable mutation, means that I know exactly what is the target and I can give you targeted treatment against that mutation. You know what's the big difference? If you have a lung cancer stage 4, no mutations, we're talking about average lifespan 1 year. If you have an actionable mutation, 5 years or more. The big difference between finding a mutation that we can attack versus just shooting in the dark is a huge difference. There are many ways in which we look and decide whether the cancer has spread. You're familiar with many of these, a plain X-ray, ultrasound, CT scan, MRI. You know, and of course nowadays you're talking about PET CT scan. This is what a PET CT scan machine looks like. If you look at this picture, any doctor in the room? No doctors. Oh, I can bullshit you anything I want then. Okay, it's easy. Okay, I don't know whether there's a pointer. I think there's a pointer. Oh, this is not a good pointer. But you see, this is the liver, the gallbladder, this is the stomach, the pancreas, the kidney. All right, it's normal. If there's a doctor in the room, he or she will not be able to tell you where the cancer is. But the moment instead of a plain CT scan, we convert it into a PET CT, oh, this patient has a cancer of the pancreas that's hiding here. So what did we do different in the two scans? What we did was we injected a tiny amount of sugar. Just a grain, 1 grain of sugar. But this grain of sugar has been tagged onto a radioactive substance. And the sugar will go to where the cancer is and light it up. So we can find the cancer more accurately. So in the past, we just do a CT scan, we say, oh, this patient has a tumor in the lung, let's send the patient for surgery. But now, we know that a CT scan is not good enough. Because when you do a PET scan, 50% of these patients that you thought had localized disease, in actual fact, the cancer has already spread. Okay? That's why it's so important that you must know where the enemy is. Number one, you must know what the enemy is. Number two, you must know where the enemy is hiding. Okay? Another example, this is a CT scan of the pelvis. This is called the pelvis in case you don't know what it is. It looks perfectly normal. Alright? But the moment we do a PET CT, we realize that this tiny little blob here is not part of the bowel, but actually where the cancer is hiding. You see how important it is? It is important because only when we can see where it is, you know where the enemy is, then you know how to treat it. Okay? So for us, very simple, patient comes to see me, we make a diagnosis, cancer, not cancer. Number 2, decide, has the cancer spread? And number 3, we need to decide, how do we go about fighting this cancer? What is the strategy? So my job is, I'm almost like a conductor of an orchestra. You know, I'm like a general behind in the war. I don't know how to fire the cannon. You know, I don't know how to fire artillery. But I plan. My job as an oncologist is I plan the battle. I explain to the patient, we are going to send in our bombers first. Then later we're going to send in the armored troops. And so why don't we send the armored troops? The reason is this. We know that in this particular enemy, in this war, this is the best way it is fought. Okay? So that's why when you talk about cancer treatment, you know about surgery, radiotherapy, and chemotherapy and hormonal treatment. One of the big advances is really in surgery. You know, we are able to look after the patient so much better before the operation, during the operation, and after the operation. And because we can look after the patient better, we can do bigger operations. You know, last time when your mother goes in for surgery, you know what's the question everyone asks? How long is the surgery? Why? Because they equate the longer the surgical time, the greater the risk and the bigger the operation. But it's not longer the case. Because the duration of surgery is not important anymore because we are able to look after these patients better. And of course, we still do subscribe to what we call minimally invasive laparoscopic surgery, whereby we try to do operations through tiny keyholes so that the recovery time is better. I still remember one year I was going to Shanghai to give a talk, and I was leaving on Friday evening. And just as I was leaving, my mom said, you know, I'm having a little bit of nausea and vomiting. I said, oh, don't worry, small problem. No, take some of this. Not better, see my good friend tomorrow morning. You know, and when I landed in Shanghai, my good friend called me and said, you know, your mom has got acute cholecystitis. Her gallbladder is infected. I said, oh. She said, I think we need to operate. I said, go ahead. And so I gave the talk, finished the talk, and I did all my work. By Sunday, I went home. My mother was up and about. On Monday, she was discharged from hospital. In the bad old days, we had to do an open cholecystectomy. It was a very difficult procedure. All right. I remember as a young doctor, I would hold on to that retractor, and the surgeon would knock your hand, pull harder, I can't see, pull harder, pull harder. You know, that's what it was like. Now nobody needs to do any pulling. And he cannot blame anybody but himself if he doesn't succeed. In the old days when he can't succeed, he says it's because I got a lousy assistant. Correct? Nowadays there's no assistant because all he has is this little telescope, and he's the only one that can see what is going on while all of us are just watching the TV. So that's how things have really changed. Okay, I'm going to show a lot of skin and flesh. So for this, if you don't mind, no photography. If you don't mind, x-rays and so on, please, words, I don't mind. But these are patients' body parts, and you know, they have given consent because they want to share their experience to help everyone. So this is what we call a mastectomy. So if you've got breast cancer in the old days, you know, everyone goes for a mastectomy, just take out the breast. What we realized that that's not really necessary. So that's why for patients with smaller tumors, we often offer a lumpectomy and lymph node dissection. Okay, the breast doesn't need to come out. All right, so there's no point in mutilating. You know, in the bad old days, really, we thought the bigger the operation, the more successful it will be. All rubbish. Okay? All right, don't take photographs of you. It's just a gentle reminder for someone who's taking pictures. You know, and you can see, for those who require mastectomy, we now are able to do reconstruction. So if you turn off the lights and you touch, it feels exactly the same. All right, so that's how good reconstruction is. It can really just use the fat of the tissue and you can re-establish it. All right, this is an example of a patient with a very advanced cancer of the head and neck. You can see, take a look. My God, we can tear the face apart nowadays. All right, this is a commando operation where they literally just rip the face apart. You can see the nose is up there and so on. And after that, we take the tumor out, we can put the face back together again. This patient was operated more than 20 years ago. All right, she's alive and well. So surgery continues to play a critical role, all right, in the success of cancer management. Sometimes, surgery can end up with great morbidity. For example, you have a cancer of the voice box. Surgery means that your voice box is gone. All of you are talkers. I've noticed all three speakers really could speak very well. They speak from the heart, they speak with emotion, and they're really great orators. Congratulations, all the speakers. But can you imagine if I took away your voice box? That's it. Sign language, you think you can communicate with all of us? Your power comes from the ability to communicate. You can't communicate, you are nearly useless. Okay, so very important. Your success is that. And that's why we now realize that whenever there's surgery that involves a vital structure, I'm sorry, I don't think a breast is a vital structure. Many of the women may disagree with me, but a voice box is certainly a vital structure. A tongue is a vital structure. So you see this gentleman, he's a negotiator. He works for some Arab government. I'm not sure. I think it's UAE or Saudi Arabia. I'm not very sure. But what he does is that he's a deal maker. So he needs to talk and talk and talk and talk. So he was found to have a cancer of the tongue which has spread to the neck. Now, this was way back in 2010. All right? And the recommended surgery in the good old days is take out the tongue. No, it's not a joke. You just take out the tongue. All right, but the advances in cancer management now allows us not to take out the tongue. Because our drugs are so effective, after 9 weeks of treatment, the tumor has disappeared. So that's how effective, that's what advances in medical science is all about. It's not a magic bullet. Many people think, are you going to find the magic bullet to cure all cancers? No, there's no magic bullet. But what we have made is great strides of success, whereby using drugs alone, we are able to make the cancer disappear. And after we have made it disappear, we add on the radiation treatment, and they're cured. This man is cured. Okay, I think his wife is Filipino, if I remember correctly. Okay, I could be wrong, but but that's what it's all about. Look at this, nasopharyngeal cancer. You know what? He owns a small travel agency in Indonesia. He knew he was diagnosed with nose cancer, and he was so frightened. He heard so much. You do the radiation, you'll be suffering. You cannot eat, and blah 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 blah. What did he do? He went to see a Chinese physician. He heard about this great Chinese physician that had come to Jakarta. So he went there. He says, "Look, I've got this nose cancer, what can you do?" The Chinese physician said, "No problem. No problem. I've got these Chinese herbs, You just take 100 in the morning, 100 in the afternoon, and 100 at night. You take this and the cancer will disappear." Desperate, he took 100 pills in the morning, 100 pills in the afternoon, 100 pills at night. After a couple of weeks, the tumor continued to grow. Went back to see the Chinese sensei. Chinese sensei, why? Why is the cancer getting bigger? The Chinese sensei said, "Don't worry, I now got another contraption. Every day at lunchtime, you come to my office, you see this bathtub? All right, we're going to soak it with water, and I put my special herbs inside. So while you are taking the pills to attack it from inside, we will soak you in this herbal bath so that we attack it from the outside." So he went every day, he went in this bathtub, he lay down for an hour, got back home and went back to work. And 1 week later, the tumor continued to grow. He said, Sensei, why? Why is my cancer growing bigger? The sensei said, "Don't worry. Tumors must get bigger before they become smaller." By the time he came to see me, he had this huge big lump, his neck couldn't turn. But by the grace of God, it was an advanced but localized, stage 3, bad stage 3, but stage 3, and no spread to other parts of the body. All right, we gave him the chemotherapy, and you can see after the treatment, the tumor melted. All right, and he was featured in my book, Doctor, I Have Cancer, and he's alive and well. He's well. Business is very bad, he says. Nobody goes to travel agents anymore. They all do their own booking online, So he says, my business is completely wiped out, but thank God I'm still alive. That's what really matters. Here's another example. A nose cancer, instead of attacking downwards, went upwards. This was a Vietnamese man after the war. He went to Canada, America, then subsequently to Canada. And what do? He was a cook, Vietnamese cook. And he kept telling the doctor, something is wrong with my eye. And the doctor said, nothing wrong with your eye. He kept saying, nothing wrong with my eye. One day his eye couldn't open anymore. So he said, by golly, you have a nose cancer. Instead of attacking downwards, the cancer has gone upwards and attacked the cranial nerves. So when you force open his eye and you tell him you look up, or you look to the left, he can't look to the left. You ask him to look to the right, it can't move. You look up, it cannot move. You look down, it moves a little bit. The nerves were paralyzed. All right? But again, when we treated him, you can see very quickly the eye could move again. And you can see, oops, sorry. He was okay. All this would not have been possible when I did medicine 30 years or more ago. It's not possible. But now it is a reality. So that's why your role as leaders in this community is to share the hope, to pass on the knowledge that cancer can be treated, cancer can be cured. All right. This simple tablet, Iressa, just a simple tablet in the past, lung cancer equals chemotherapy. If you have lung cancer and you have the EGFR mutation, there's a whole host of drugs. There's Iressa, there's Tarceva, there's Tagrisso, and so on and so forth. And literally, look at this patient. The lungs were studded, hundreds of nodules. Hundreds of nodules. But they just need to pop that tablet and it all disappeared. It's not magic. It is through hard work, research, that advances in medical care that have made the difference. Look at this patient. The PET scan shows the spine studded full of cancer. And look at it after treatment. Everything is gone. One of the cancers that we often have to deal with, no photographs please, is locally advanced breast cancer. Sometimes, I give you all the reasons, Ray. Sometimes it's ignorance, sometimes it's just, giving up hope. You would imagine that this is a Singaporean. Singapore, as you know, is a developed country. People are educated. This lady is not a road sweeper. She's an administrator. She works in an office. She knows how to use PowerPoint, Excel sheets, and so on and so forth. But her husband was a Taoist priest. All right? And they believe in divine healing. They will pray. The joss sticks, the ashes will form. They will mix these ashes with water and she'll drink, hoping that God, as they knew him or her, would cure her of her cancer. But her cancer continued to grow. She continued to go to work every day. And you know what she does before she goes to work? What she does and what you do is completely different. She has to layer her breast with layers and layers of tissue paper so that it doesn't soak through her clothes as she works. When people go for tea breaks, she'll go to the bathroom, she'll peel off those layers, and then put on new layers. And that's why if you look very closely at this photograph that I took when she first came to see me, you can see the tissue paper that's still stuck when I tried to remove it. It was stinking. If you want to know what a dead rat smells like, you just need to be in my room at that time. It is foul-smelling as the tissue dies. But, this is a close-up to show the tissue paper. I'm so proud of my photography. It's really so good, don't you agree? It's really good for you, and before lunch, you just take a look at this, and I'm sure you can eat better. But again, you can see, once we treat the patient, the tumor melts. It just simply melted away. All right? And if you've never seen a cancer, what it looks like inside you, this is a good example of what it really looks like when we operate. But this is outside. And that's why I find it so useful to show this to patients sometimes when they ask what does the cancer look like. And we've got many agents, you know. Now in breast cancer, we want to know, do you carry the HER2 oncogene? You have the HER2 oncogene, we have anti-HER2 treatment, means monoclonal antibodies. Look at this lady, large tumor, 70 years old. When she came to see me, she says, look, I know I need chemotherapy, but I have got conditions. I said, Auntie, what is your condition? My condition is, I will let you treat, but my hair must not drop. 70-year-old lady, all she's interested in is, you make sure my hair does not drop. And I promised her, your hair will not drop. And so you can see, we now have agents that you can see this huge, large tumor and how well it responds to treatment, and the hair did not drop, you know. Oh my God. You must think, how can? This is a doctor. It's a doctor from one of the countries that I serve. All right, I cannot tell you which country because it will be very insulting to the country. But she herself as a doctor said, cancer cannot be treated. Why do I want to treat? So she probably studied the medicine way before same as my time, you know, when cancer was a death sentence. So she did it. No photography, please. Thank you. Much appreciated. You can see. And she allowed the cancer to grow and grow and grow, and you can see, and it was the whole chest. The only other doctor that she has seen other than herself in the mirror was me. And I told her, I said, look, no photography, please. Sorry, just put on your cap. Thank you very much. You know. And I said, look, you know, your cancer can be treated. You have a HER2 positive tumor, and we treated. She went back to work, and she lived for a good number of years before she eventually, you know, gave up on treatment and died. But cancer can be treated. Look at this patient, 75 years old. The liver is studded. The whole liver, look, full. It's like cheese. Is that what cheese looks like? I don't like cheese. Someone likes cheese, so they can tell me. Take a look, you know. This is what it looks like. Next time you eat cheese. You know? All right. But once we treat, the tumor disappears. All right. There are many, many agents now that we can use. This is a Filipino, Auntie Lulu. All right. She came to see me on the 28th of May, 29th of May. The family brought her to Sentosa for a holiday, you know, thinking this is your last visit to Singapore. Look at the tummy. The tummy's all swollen. Legs are all swollen. All right. Look at the face. It's like these war prisoners, you know, they are really cachexic. But liver was completely replaced, colon cancer. And after treatment, look at her. She went on to live for a number of years before she eventually succumbed to the illness. So cancer is treatable. Lymphoma, one of the highly treatable conditions. Look, the moment we treat lymphoma, the disease disappears. The hair hasn't even started dropping. In other words, this is all a question of days of treatment, and then the disease disappears. Leukemia, lymphoma, these are blood cancers. Very, very treatable if you know how to treat it. All right, another example of a lymphoma. In the PET scan showing a marvelous response. The most treatable cancer that's known to man. What's the most treatable cancer known to man? Not many of you will know. No! Testicular cancer. Testicular cancer. That is the cancer that even if you've got stage 4 testicular cancer, you still have an 80 to 90% chance of cure. All right? So, if you ever feel something in your balls, don't hesitate to see a doctor because we can take care of it. You heard that, my friend? You okay? Okay, just in case. Just in case. Okay? You know, this young boy, I think he came to see me. I can't remember his age, honestly. Either 3, 4, or 5 because of a young boy. Take a look. The father carried him and put him in my bed and said, look, I'm come from a very poor city of Batam. The doctors have seen my son. They say, bring him home, give him morphine, let him die. I looked at him and I said, my God, you know, I can cure this boy. And the father looked at me and said, are you joking? I said, no, I don't joke. I said, I think I can cure this boy. This boy has testicular cancer. I just show the pictures. See? Amazing. We just gave him the medicine. You can see the big tumor just died, turned black. The big hole in the stomach got smaller. No surgery, it just gradually shrank. Right, look at the testicular swelling. No CT scans, nothing. No money for CT scan. We just made the diagnosis, gave the treatment. And look, He's cured. You know, by the grace of God. Look at him. He's a very cute little boy. He speaks Teochew. How many of you speak Teochew? You know, at that time, those are the old days when I used to treat children. I no longer treat children because we've got specialists in my group that treat children. But in those days, I'm an oncologist that treated everything. Lymphoma, leukemia, you name it, I handle it, you know, really. But now we are very specialized. Okay? He used to sit on my lap. And he told me, he says, "Doctor, I'm going to study hard." I said, "Very good." I said, "Education is very important. Education will lead you to a higher chance of success." And he says, "You know, when I grow up, I want to be a doctor." I said, "Very good. As a doctor, you can help people. You can also earn a good living and help your family." Got off my lap, he ran to the door. Then he opened the door. As he was going out, he turned around and he said, "Dr. Ang, when I become a doctor, I'm going to set up my clinic that's opposite yours, and I'm going to steal all your patients." So he's grown up. And the good news for me is he's not a doctor, he's an accountant. He's doing very well, but he can't steal my patients. All right, that's a relief because he's a clever boy. I come from Singapore. Singapore is a very tiny island. We are about 3.5 hours away from Philippines, you know. We see patients from the whole range of countries, starting all the way from Myanmar on the north, you know, to Vietnam, Cambodia, then across over to Philippines, of course, down to Malaysia, Indonesia, all the way on the other side, to Pakistan, India, Bangladesh, Sri Lanka. You know, we see patients from a whole range of countries. And our healthcare system is one that we are very, very proud of. We try to provide the best care for our patients, both Singaporeans as well as non-Singaporeans. All right, I come from Parkway Cancer Center. Parkway Cancer Center, this is our medical team. I'm the medical director, and we have got 17 doctors. We specialize in all the various cancers, blood cancers, leukemia, lymphoma, lung cancer, ovarian cancer. There's no cancer that you can have that we have not seen, so don't worry about it. What do we want? We want to do our best for each patient, to do our best in providing a holistic care. It's very important for us, not besides, you know, just treating the cancer, but really to provide that care for the terminally ill, as well as to provide the support services that are so much needed, the psychological support that everyone needs. We have got Can Hope offices all over the region. We have one in the Philippines as well. These are offices which are free of charge. You know, you can see them and get advice and second opinions on management of your cancer. I've written another book that's called Hope and Healing. This is really about, you know, how it's important to have hope in order to be healed. So that's the purpose of this lecture, is really to inform you of the advances in cancer management. And one of the important things I tell myself is what I see in this doctor's prayer. Lord, as I treat my patients, help me to be wise. Let me see their problems through your discerning eyes. Guide me, Lord, and use me in everything I do, for you are the great physician, and I long to be like you. Thank you, ladies and gentlemen.